Good evening, everyone. This is Dr. Patmos. It is late at night on October 7th, 2025, and I wanted to do a little follow-up video on an article that I posted last night, also quite late. So for those of you who didn't see what I posted last night, it's on my Substack page, but I wrote an article about the big brouhaha over biodistribution of the COVID mRNA vaccine that erupted at the last ACIP committee meeting. There was very terse questioning of the Pfizer representative by Dr. Robert Malone, basically insinuating that Pfizer had not done a good job in assessing biodistribution of the vaccine, that there was this claim made by somebody that the vaccine only stays in the arm and it doesn't go throughout your body, but actually, Dr. Malone proved that it actually does distribute in other parts of the body, like the lymphatic system and the liver and spleen, and that this is a big problem, and that there was collusion between Pfizer and the FDA to basically downplay the biodistribution. In essence, that biodistribution is a problem. And so I kind of did what I could to pretty much blow up the biodistribution issue, and I posted that last night. Well, you would think, based on the responses that I got from some, that I drove over somebody's grandmother. I mean, I got some really nasty responses to that post, and it even was taken off of LinkedIn because someone complained about it being misinformation. So I thought what I'd do tonight is make matters even worse and destroy the biodistribution, spike inflammation, delusion even more. So if you look below in the text, I provided some very important documentation. So let me just tell you what the facts are, because this is all about just the facts. No one actually involved in the production of the vaccine or the approval of the vaccine ever came out and said it only stays in the arm, because that's ridiculous. If a vaccine stays in your deltoid muscle, how on earth is it going to stimulate an immune response? The vaccine has to get into the lymphatic system. It has to get antigen into the lymph nodes, into the lymphatic system to stimulate the germinal centers where the lymph nodes actually produce the antibodies that are the part of the immune response. And it has to get into the lymph nodes to produce the cell-mediated immunity with the T and B cells and the memory lymphocytes and so forth. So the notion that the vaccine stays in the deltoid doesn't make sense, because that's not how a vaccine works. It has to get into the system. So biodistribution is expected. I attached an article from Nature magazine, the journal Nature, which is a very prestigious journal, that showed that even as far back as 2021, everybody knew that this vaccine has biodistribution and that it's not a bug. It's a welcome benefit. This is what you want to happen. So the notion that somebody was hiding biodistribution and that they lied about it is really delusional. The second point is, does the biodistribution of the mRNA vaccine and the spike protein that it generates, does that cause inflammation? Yeah, it does a little bit in very small amounts. And that inflammation is what triggers the immune system to produce the immune response. If you fear the spike, you really need to fear the virus, because the virus produces spike protein in levels logarithmically greater than what the vaccine produces. The whole purpose of the vaccine is to trigger a little bit of inflammation with the spike protein so that you develop an immune response. That's a lot better than triggering the spike protein with the virus, which gives you much more spike protein. So if you fear the spike, fear the virus, not the vaccine. So, the last thing is, there's no, what I showed last night is there's really no clinical significance to this biodistribution issue. There's no evidence that it actually makes any clinically significant pathologic difference that we need to be concerned about. So, what evidence do the anti vaxxers point to? VAERS. Well, you can't use VAERS that way. For the 7 millionth time, I and many others have repeatedly showed that VAERS is a non-filtered reporting system. Anybody can report anything. As a result, almost all the VAERS reports are silly, and you just can't use VAERS. It's the disclaimer is very clear. It's coincidental and unverified and so forth. So read what I posted down below for more details. So basically, the whole argument that the anti-mRNA vaccine crowd is relying on biodistribution, inflammation, leading to pathology falls apart on closer inspection. Biodistribution is to be expected and welcome. It was never withheld from the public by some conspiracy between Pfizer and FDA. And there's no evidence that's clinically significant as a cause of disease. You can't rely on VAERS for that. That's not what VAERS is for. Just read the disclaimer on the VAERS website. So hopefully that clears things up for you. It's really no wonder they got so riled up, because this whole biodistribution inflammation spike VAERS, that's their line of thinking. That's all they have. And that's what their entire objection to the mRNA vaccine is based on. And it's flimsy. It doesn't have any real substantial footing. And on closer inspection, the whole thing just falls apart. So no wonder they got defensive. Anyhow, that's my post for tonight. I hope you enjoyed it. Have a great day. And oh, by the way, get vaccinated. It's not about you. Yes, it's great when you get vaccinated, you have some protection. Vaccination is about society. It's about your moral and ethical duty not to allow yourself to become a virus factory, maintain, host, replicate, mutate, and disseminate virus to harm others. It is your moral and ethical obligation to get vaccinated. Thank you.